The title of this next video series could be called Things I Say About 100 Times a Week. And the first thing that we end up talking a lot about at our office is flossing. And flossing is one of those things that in dentistry has kind of become a joke. Patients are like, yeah, oh, you're a dentist, I never floss. It's like it's some big confessional. And dentists even, I hear joking with patients like about, you don't have to floss all your teeth, just the ones you want to keep. Anyway, I thought it might be a good little review to talk about flossing and why it's so very, very important. A lot of patients most patients would never consider skipping brushing their teeth. Everybody brushes their teeth twice a day, I think. And yet they just are very cavalier about the flossing part of it. And since most adults are more likely to lose their teeth from gum disease than cavities these days, flossing is actually more important than brushing. And if you're only going, in my opinion, and if you're only going to do one, I would challenge my adult patients to just do flossing for a while, see how it goes. I had one patient tell me, and this is so gross, that she always sniffs her floss after she flosses to see if she's doing a good job. And as gross as it is, it actually has some merit, because if you're flossing and cleaning between your teeth often enough, there should be no odor on the floss after you clean that area. If there is, that's evidence of necrotic tissue, rotting food, and bacteria. And that's just gross. And the smell is awful when that happens. So anyway, I thought we'd review flossing and why it's so very important. Proper flossing technique, I recommend a piece of floss as long as your arm, and this one actually is even longer. And the reason for that is that it's really good to use a fresh piece of floss between every tooth. If you think about it, you're cleaning bacteria. And if you go in a systematic way, starting in the back teeth, and maybe have some localized gum disease in that area, or even just localized bacteria, when you finish cleaning that area and you move to the next spot, you're actually transplanting that bacteria unless you use a fresh piece of floss each time. So I find the technique that works really, really well is to coil the floss up on one hand and leave it uncoiled on the other. So I'm actually going to coil it up on my offhand, and I like to use my middle finger. It's a better way to use your middle finger. And then on your other hand, start coiling with just one. Now you have most of it wound up on your offhand, and you're using your, for example, I'm right-handed, your strong hand as the lead, okay? By coiling it on your middle fingers, it leaves these two fingers available to do all the work. And like I said, you want to go in a systematic way, starting from the upper right, for example, to the upper left, then to the lower left, and all the way around. And with each tooth, you would then uncoil and recoil to the next fresh little spot. And so I have this much going here, and then I'm going to pinch in between, and I have about an inch in between. So that's my working area. Now when you go in between the teeth, it's very important to remember that flossing works more than one way. When you go up in between the teeth, you are, even if you use bad technique, you are pulling oxygen into that space between the two teeth. Right now, you can't see them because they're little, but this piece of floss is covered in oxygen molecules from the air. And the bacteria that are doing all the badness in between the teeth are anaerobes. That means they can only live in the lack of oxygen, so oxygen kills them. So simply by pulling the floss down in between your teeth, you're pulling oxygen into that area, and that is bactericidal. In other words, it kills the bacteria. But the other way that floss works is the mechanical removal of plaque. And plaque is that sticky, sticky material that's between your teeth. If you go camping and you skip brushing your teeth, you'll feel that, that film on your teeth. That is plaque, that sticky debris. It's proteins from your saliva, it's the bacteria, it's food debris. And it is brushed off when you brush your teeth, but it's very persistent in the angles between your teeth. So when you go in between flossing your teeth, you need to remember that you're cleaning two different surfaces now. So you pull the oxygen up there. If you pull straight down, you've done one thing great. But if you really want to make your flossing very effective, you need to remember to clean both teeth on either side of that space. So you're going to go up and then pull the floss towards the first tooth that you want to clean. And once it's pulled, move straight up and down. One mistake that people make is they go up and floss and then they do a sawing motion. And just like sawing and cutting down a tree, the old way that the lumberjacks used to do it, you can actually notch a very destructive groove on your tooth if you floss that way. So although you want to wrap like a towel on your back, you don't want to do that drying motion like a towel on your back. You want to move straight up and down. So the floss goes up in between the teeth. I'm going to do this tooth first, so I'm going to curl against that tooth, move up and down. Now I come down, go to the other tooth, and up and down. And you really want to think of it as a scraping motion. The motion that's most effective would be the same as if you're squeegeeing the water off of a shower glass door. That kind of scraping motion is the motion that you're trying to do here. So clean, 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 wrap to the other side, clean, 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 then unwind to a clean piece of floss. If you want to do the gross technique, give a snip to see how clean that area is, and now go to the next spot. Clean, 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 unwind, clean, clean, clean. Once you get really good at this and have the manual dexterity, you can make the whole trip around in just a couple of minutes. Now, for some patients, especially elderly patients, this just doesn't work. Or little kids, there's just not enough manual dexterity to do this properly. And if that's the case, there's so many great flossing cheaters out there. I'm going to show just a few. One is a floss holder, and there's lots of variations of it, but usually it's a fork and the floss fits between the fork, and then you would clean that way. The problem with that one is that you are using the same piece of floss all the way around the mouth. So if you use one of those floss holder cheaters, Glide Floss Picks makes one. In the drugstore, there's a whole section of them. They come in a bag of 50 to 75 in a bag. If you use those, it's a really good idea to use 2 or 4 for your whole mouth. So use a new one for each corner, or maybe use one for the top teeth and one for the bottom teeth. Some other ones are, there's a multitude of picks available that go in between your teeth. This one is like a toothpick. My grandpa used these for years. These are really popular with the older gentlemen. This is called soft picks. Love these. One of the reasons I love these, they come like a matchbook, so you break one off. And I love these because the Christmas tree shape is graduated, so for between the back teeth it gets bigger, and between the front teeth you can use just the tip. They can be bent to angle and reach back teeth, and they can be used under bridges, under braces, and because they're rubber, you can rinse them off and clean them before you go to the next area, so kind of keep the bacteria count down. Another one that's similar to that are Therapicks. These are very popular with gum specialists called periodontists and periodontal patients. Similar idea, it's just a coiled up piece of plastic, and it's graduated, so works really well in tight spaces or bigger spaces in the back. And this one can also be bent. Again, that one's called Therapic. There's also some devices on the market now that use air. This one's air, and you add your mouthwash to the reservoir here, or warm water, and it actually blasts the water between your teeth, the air or water. And so that one's really cool. Maybe not as effective as the water picks or Hydrofloss, which are also amazing, but a little bit cheaper and obviously a great travel size. My younger patients with braces love this. So anyway, those are just a few options available. I really prefer the thicker flosses for those patients who are going to floss. I love Denotape. If I could get yarn between my teeth, I would, but the thicker it is, the better scraping motion I feel like I get. Sometimes it's too tight a squeeze and the floss will tear, so those patients are very fond of Glide floss. Glide does a good job of bringing the oxygen in, and I just find that when I'm doing the coiling motion with it, because it is a little bit slippery, I find that my coil doesn't stay coiled as well. But you know, it's great. There's nothing wrong with this, but if you're asking me my favorite, I like the thicker one. So anyway, that's a general overview of flossing. I hope that it's helped you. If you're one of our existing patients, let us know that you watched this video, and we'll give you a little something extra special next time you come in. Bonus points. And if you're not an existing patient of ours, why not? Come on in. There's lots more great information to share with you.